In Springfield, as is the case with other western Massachusetts cities, men of color suffer from higher rates of almost every negative health category than our white counterparts. And as a matter of fact, we suffer from higher rates of these negative health categories than men of color living in the eastern part of the state. These negative health disparities include asthma, hypertension, other forms of heart disease, diabetes, obesity, STDs, victims of violent crimes. Oh, wait a minute, what did I just say? Victims of violent crime. Yes, that's a health issue today. That is a health disparity issue. We also suffer from substance abuse and premature mortality. Nonetheless, Dr. Jewel Mullen and her staff, as well as the MOCHA organizers and focus group members, many of those focus group members are standing behind us, are determined to improve the health of men of color in the city of Springfield. And our community has been awarded $250,000 to do this important work. MOCHA has created a multitude of comprehensive and integrated strategies to improve the health of men of color over the next 2 years, beginning with a pilot group on July 1st of this year. This initiative will be relevant, it will be visible, it will be proactive, and our strategies will be implemented in concert with other initiatives going on in the city of Springfield. You will rarely see MOCHA by itself. You will almost always see MOCHA doing its work in conjunction with other community-based organizations and other community health initiatives. Am I right?
Right. Yeah.
So how will we sustain this effort? We will sustain this effort by a cadre of community health workers who will graduate from this program, this health and wellness program. These individuals will share their experiences, their health and wellness knowledge, and their commitment to self-improvement and self-preservation with other men of color in the city of Springfield. This approach will assure that our numbers will grow geometrically with each and every cohort of program graduates. As the health disparities disappear, men of color will live prolonged lives and fulfilling lives and improved lives.
African American males in this city and across the country, average lifespan is 68 years old. That is absolutely unacceptable. It is for men of color of Puerto Rican descent, it's 72 years old. Absolutely unacceptable. And that's why today I stand in solidarity to say that this data is unacceptable. We are unwilling to accept it. And behind me is the reason. We have men who have stepped up, who have stepped out, who believe in the vision, who believe in the movement, and they believe in the power that lies within themselves to make these behavioral changes for themselves and for this city, because we absolutely need them on the front line. We need them as the vanguard if we are to move the city of Springfield and this nation forward.
This is a collaborative effort that involves a whole array of other community-based organizations. And it's that array of community-based organizations that's making a difference here. And what we've consciously done is we come into a room together and we created a process. We created a program, but we created first a process. And that process involved discussions about trust. And we dealt with the trust issues right from the very beginning. Trust issues. Trust between organizations, trust between leadership of organizations, trust around competition, resources, and all of those things. We dealt with that right up front. And then, as we began to do the work, whenever the typical ways in which work has been done in the past raised their ugly heads, we called it as we saw it, and in calling it, we decided to conduct ourselves differently. What we've all recognized in that collaborative effort is that there is an incredible cadre of individuals in the city who are doing enormously wonderful work, and our goal is to get those folks together and unify the work, and in the same process convince them that that their work will be magnified by doing it in concert with each other. We have also consciously, in terms of leadership development, placed responsibility for this effort on the shoulders of some young individuals, some up-and-coming leaders, because we understand, as we all do, that the only way to become a leader is to lead. It's like, if you want to run fast, you have to run fast. If you want to lead, you have to have opportunities to lead. And there's not a single leader in this country who took some class where they learned how to lead.
And then that was it.
And that was it. What happens in leadership development, I think, comes about through the opportunity to lead.
This initiative and its sustainability is really based on the foundation that we're creating a group of individuals who understand what it means to take care of themselves and their families and their communities. And then they're going to take that learning and they're going to share it with others.
Yeah.
And then those that they share it with are going to share it with another. And this thing's going to grow geometrically in that way.
Yeah, I mean, in my short time that I've been doing this kind of work, I've been a part of some of these initiatives and part of these groups, and nothing really seems to come of it because the energy is. When I stepped in the room from the first time, I felt the presence of Mr. Morton, Mr. Johnson. Now these are men that I've grown up in the city knowing and do the work in the city. And so when I step in the room with them and they're doing this work, and I can be a part of it, and that's something I need to latch on to. But then, the talking, here's how important it was for this to be a grassroots type of thing. So none of that planning top down, total bottom up, everything that we've done so far has been in collaboration with the men. There's nothing, no decisions, no hard decisions that we made without their input. And not only just, not just listening to them, but they're actually listening to them and then acting.